Here's something that will shock you. Nearly 7 million Americans over 65 are living with depression right now, but 70% of them will never receive proper treatment. Why? Because both they and their families mistake the symptoms for normal forgetfulness that comes with aging. But here's what most people never realize. The difference between simple forgetfulness and depression-related memory issues can literally be a matter of life and death. Depression in seniors increases the risk of heart disease by 40% and doubles the chance of developing dementia. The most important warning sign that separates these two conditions is something 90% of families completely miss, and I'll reveal exactly what that is at the very end of this video. This isn't just about getting older and accepting that your mind isn't as sharp as it used to be. Depression is a real medical condition that affects your brain's ability to form and recall memories, and the good news is that it's completely treatable at any age. Your brain has an incredible ability to heal and adapt even in your 70s, 80s, and beyond. The key is knowing what to look for and taking action before these symptoms rob you of years of joy and connection with the people you love most. I want to hear from you right now. How old are you? Write your age in the comments below, because I personally reply to everyone, and I want to give you specific advice based on your stage of life. Also, if you've ever worried about whether your memory changes are normal or something more serious, type the word worried so I know this video is hitting home for you. Let's start with sleep patterns, because this is where many people first notice something isn't quite right. Normal forgetfulness doesn't typically disrupt your sleep. You might forget where you put your reading glasses or struggle to remember the name of that actor in the movie you watched last week, but you still fall asleep at your regular time and wake up feeling reasonably rested. Depression-related memory issues come with a completely different sleep signature. You might find yourself lying awake at 3 in the morning, your mind racing with worries about things you forgot to do or conversations you can't quite remember having. Or you might sleep 10 to 12 hours and still wake up feeling exhausted and foggy. Here's why this happens. Depression disrupts the production of neurotransmitters like serotonin and dopamine that regulate both mood and sleep cycles. When these chemicals are out of balance, your brain can't properly consolidate memories during sleep, which makes forgetfulness worse during the day. Pay attention to this pattern. If your memory problems started around the same time as sleep changes, and especially if you're waking up between 2 and 4 a.m. feeling anxious or sad, this points toward depression rather than normal aging. Try keeping a simple sleep diary for 1 week. Write down what time you go to bed, how long it takes to fall asleep, how many times you wake up, and how you feel in the morning. If you see a pattern of poor sleep plus increased forgetfulness, it's time to talk to your doctor. The second warning sign involves your appetite and interest in food. Regular forgetfulness doesn't change how much you enjoy your favorite meal or look forward to Sunday dinner with the family. But depression can completely alter your relationship with food, and this directly impacts your memory. Some people lose their appetite entirely and start forgetting to eat meals, which starves the brain of glucose and nutrients it needs for proper function. Others find themselves eating constantly, especially sugary or processed foods that cause blood sugar spikes and crashes. These crashes make concentration and memory formation much more difficult. I had a patient named Margaret who came to me worried about her memory because she kept forgetting appointments and losing track of conversations. When we dug deeper, she realized she'd been skipping breakfast and lunch most days because food just didn't appeal to her anymore. She'd lost 15 pounds without trying, and her brain was literally running on empty. Within 3 weeks of establishing regular, nutritious meals, her memory complaints improved dramatically. Here's what you can do starting today. Set 3 gentle alarms on your phone for breakfast, lunch, and dinner. Even if you don't feel hungry, eat something small and protein-rich, like Greek yogurt with berries, a handful of nuts, or a hard-boiled egg. Your brain needs steady fuel to form and retrieve memories properly. Now let's talk about social connections, because this is where the difference becomes really obvious. Normal age-related forgetfulness might make you feel slightly embarrassed when you can't remember someone's name at a social gathering, but it doesn't make you want to avoid people altogether. Depression-driven memory issues often come with a strong desire to isolate yourself. You start declining invitations because you're afraid you'll forget important details about people's lives or lose track of conversations. You might stop calling friends because you can't remember what you talked about last time, or you worry you're repeating yourself. This creates a vicious cycle because social isolation actually makes both depression and memory problems worse. Human connection stimulates the production of oxytocin and endorphins, which are natural mood elevators and brain protectors. When you withdraw from social activities, your brain loses this crucial stimulation and depression deepens. Here's a gentle way to break this cycle. Choose one person you trust and explain what you're experiencing. Ask them to be your social accountability partner. Schedule one brief interaction every day, even if it's just a 5-minute phone call or a text message. Don't worry about having perfect memory during these conversations. Focus on the emotional connection, not the details. Most people care much more about your presence and warmth than whether you remember every fact perfectly. Physical symptoms tell a completely different story when depression is involved. Simple forgetfulness doesn't usually come with unexplained aches and pains, but depression often does. You might develop chronic headaches, back pain, or joint stiffness that doesn't seem related to any specific injury or medical condition. This happens because depression triggers inflammation throughout the body, including in the brain. Chronic inflammation interferes with the formation of new neural pathways and disrupts existing memory networks. It's like trying to make a phone call when the wires are corroded. The connections just don't work properly. Additionally, when you're dealing with constant physical discomfort, your brain has less energy available for memory formation and recall. You're using so much mental bandwidth managing pain that there's not enough left over for remembering where you put your keys or what you need from the grocery store. If you're experiencing memory issues along with new or worsening physical symptoms, especially if medical tests don't reveal a clear cause, depression could be the underlying culprit. Start by tracking your pain levels and memory problems together. Use a simple 1 to 10 scale each evening to rate both your physical discomfort and how forgetful you felt that day. If you notice they tend to rise and fall together, this is valuable information to share with your healthcare provider. Energy levels provide another crucial clue. Normal forgetfulness doesn't sap your overall energy or motivation. You might feel frustrated when you can't remember something important, but you still have the drive to keep trying, to write things down, or to ask for help. Depression-related memory issues come with a profound sense of fatigue that goes way beyond normal tiredness. This isn't the kind of tiredness that gets better with a good night's sleep or a cup of coffee. It's a bone-deep exhaustion that makes even simple mental tasks feel overwhelming. You might find yourself staring at a grocery list you wrote yourself, unable to summon the mental energy to remember why you needed those items or where to find them in the store. This happens because depression literally changes how your brain uses energy. Normally, your brain efficiently allocates resources between different functions like attention, memory, and emotional regulation. Depression disrupts this process, causing your brain to waste energy on rumination and worry instead of using it for productive thinking and memory formation. The result is that you feel mentally drained even when you haven't done anything particularly challenging. Combat this by breaking mental tasks into smaller pieces. Instead of trying to remember a long grocery list, focus on just 3 items at a time. Give yourself permission to rest between mentally demanding activities and celebrate small accomplishments instead of focusing on what you can't remember. Here's something most people never consider. The timing and pattern of your forgetfulness reveals whether depression is involved. Normal age-related memory changes tend to be fairly consistent throughout the day. You might be slightly sharper in the morning and more forgetful in the evening, but the difference is usually mild. Depression creates much more dramatic fluctuations. You might have periods where your memory seems completely normal, followed by hours or days where you can barely remember what you did that morning. These fluctuations often correspond with mood changes. On days when you feel particularly sad, hopeless, or anxious, your memory problems become much more severe. This happens because emotional distress hijacks the brain's attention systems. When you're consumed with negative thoughts and feelings, there's literally less mental capacity available for encoding new memories or retrieving old ones. Pay attention to whether your forgetfulness gets worse during times of stress, sadness, or anxiety. If you notice this pattern, it strongly suggests that treating the underlying depression will improve your memory problems. Keep a simple mood and memory journal for 2 weeks. Each evening, rate your overall mood and memory function on a scale of 1 to 10. If you see a clear correlation between low mood days and high forgetfulness days, this is important diagnostic information. The content and focus of your forgetfulness also differs significantly. Normal age-related memory changes typically affect recent events more than distant memories. You might forget what you had for lunch yesterday, but remember your wedding day 50 years ago in vivid detail. Depression creates a different pattern. It often impairs your ability to recall positive memories while making negative memories feel more prominent and intrusive. You might find yourself dwelling on mistakes you made decades ago while struggling to remember recent accomplishments or happy moments. This selective memory impairment happens because depression literally rewires neural pathways to favor negative information processing. The brain becomes hypersensitive to threats and problems while filtering out positive experiences. Over time, this creates a distorted view of your life where difficulties feel overwhelming and joys seem rare or unimportant. Challenge this pattern by actively practicing positive memory recall. Each evening before bed, deliberately remember 3 good things that happened that day, no matter how small. Write them down if necessary. This isn't about fake positivity. It's about retraining your brain to notice and remember the full spectrum of your experiences, not just the negative ones. Now, here's the most important warning sign that 90% of families completely miss, and this could save your life or the life of someone you love. When depression is causing memory problems in seniors, there's almost always a specific trigger event that started the whole cascade. This might be the loss of a spouse, a major health diagnosis, retirement, moving to a new home, or even something seemingly minor like a grandchild going off to college. Normal age-related forgetfulness develops gradually over years without a clear starting point. Depression-related memory issues often have a definable beginning that family members can pinpoint if they think carefully. The person seemed mentally sharp until sometime after that difficult event, and then the memory problems began and progressively worsened. This distinction is crucial because it tells you that the memory issues aren't inevitable or permanent. They're a symptom of grief, adjustment difficulties, or unprocessed emotional trauma. When you treat the underlying emotional wound, memory function often improves dramatically. If you can identify a trigger event that preceded your memory concerns, this is actually hopeful news. It means your brain is likely structurally healthy, and the memory problems are related to treatable emotional factors rather than irreversible neurological changes. Let me bring this all together for you because understanding the difference between normal forgetfulness and depression could literally change your life or save the life of someone you care about. Depression in seniors is not a normal part of aging, and neither are the memory problems that come with it. Your brain has a remarkable ability to heal and adapt at any age when it receives the right support. The key is recognizing the warning signs we've discussed and taking action rather than accepting these changes as inevitable. Remember, depression-related memory issues come with sleep disruptions, appetite changes, social withdrawal, unexplained physical symptoms, energy depletion, mood-dependent fluctuations, negative memory bias, and often a clear trigger event. Normal forgetfulness doesn't typically include these accompanying symptoms. Even small changes in how you care for your mental health can make a significant difference if you're consistent with them. You're not alone in this journey, and you don't have to accept cognitive decline as your new reality. If this video helped you understand the difference between forgetfulness and depression, please hit the like button and subscribe for more trustworthy health information specifically designed for people over 60. Turn on notifications so you never miss important content that could protect your health and well-being. Share this video with family members or friends who might be struggling with similar concerns. You could be helping them recognize something crucial about their own health. Which warning signs surprised you most, or what other topics about senior health would you like me to cover next? Write your thoughts in the comments below, and I'll personally respond to help you with your specific situation.